Welcome to the world of hospitals, a world of care, science, and teamwork. Every hospital is like a small city, full of corridors, signs, sounds, and stories. Inside it, thousands of people work together every day to help others heal. But if you're learning English, especially medical English, hospitals can be confusing. Different rooms, different departments, and sometimes even different words in British and American English. Today, we're going to take a tour through the hospital, step by step, and learn what each department does, who works there, and how you can talk about it correctly, whether you're speaking British or American English. So, let's begin our journey. The reception or information desk. Imagine you've just walked through the main entrance. You see bright lights, signs on the walls, and people moving quickly. Right in front of you is the reception or information desk. This is where every hospital journey begins. Receptionists help patients register, give directions, and book appointments. They are the first voices you hear and the first smiles you see. In both the UK and the US, the name is almost the same, reception or information desk. But in the US, you might also hear front desk or check-in counter. No matter the name, it's the place where information meets care. Emergency room, or ER. Accident and emergency, or A&E. If a patient arrives in serious condition, perhaps after an accident or with chest pain, they are taken straight to the emergency room in the United States or the Accident and Emergency Department or A&E in the United Kingdom. The difference is mostly linguistic, but both places are built for speed. Doctors and nurses in this department work under constant pressure, providing urgent care, stabilizing injuries, and managing trauma. Here you'll hear words like paramedics, triage, and urgent care. It's the department that never sleeps. Intensive care unit, ICU. From the emergency room, some patients are moved to the intensive care unit, or ICU. This is a quiet, high-tech area where the sickest patients receive constant monitoring. The medical team here includes critical care doctors, intensive care nurses, and respiratory therapists. Operating theater, or operating room. When patients need surgery, they are taken to the operating theater in the UK, or the operating room, often called the OR in the US. The British term theater dates back centuries when surgeries were performed in front of students, like an audience. Today, it's a sterile environment where precision and teamwork matter most. Surgeons, anesthetists, and scrub nurses prepare for procedures using specialized instruments such as scalpels, clamps, and sutures. The word may differ, but the work is identical, saving lives through skilled hands. Radiology, or imaging department. The radiology department, sometimes called the imaging department, is the place where X-rays, CT scans, MRIs, and ultrasounds are performed. Radiologists interpret these images, while radiographers and technicians operate the machines. In both British and American hospitals, radiology is used, but American facilities sometimes use the term imaging center. Whether you're checking for broken bones or tumors, it's the department that turns pictures into diagnoses. Maternity ward, or labor and delivery unit. Let's move to a brighter, happier part of the hospital, the maternity ward. In the United States, it's usually called the labor and delivery unit. Here, obstetricians, midwives, and nurses care for mothers before, during, and after childbirth. It's a place filled with emotion, sometimes pain, but mostly joy. Pediatrics, or Pediatrics. Nearby is the Pediatrics department, which treats children and adolescents. In British English, it's spelled Pediatrics with an extra A, but the pronunciation is the same. Pediatricians, pediatric nurses, and child specialists care for young patients suffering from infections, asthma, or injuries. The walls are colorful, the rooms smaller, and the tone softer. Oncology Department. The Oncology Department is the part of the hospital that focuses on cancer treatment. Oncologists and oncology nurses manage chemotherapy sessions and coordinate with radiologists and surgeons. It's a department that combines science and compassion. In both the UK and the US, the word oncology is the same because the challenge and the hope are universal. Cardiology. The cardiology department focuses on the heart and circulatory system. Here, cardiologists perform ECGs, echocardiograms, and cardiac catheterizations. Patients with heart attacks, arrhythmias, or hypertension come here for specialized care. The word cardiology is universal. The pronunciation may differ, cardiology in American and cardiology in British, but the meaning is the same: care for the heart. Pharmacy, or chemist, or drugstore. Every hospital also has a pharmacy, the department where medicines are prepared and dispensed. In the UK, you might hear chemist, and outside the hospital, the chemist's shop. In the US, public pharmacies are often called drugstores. Inside hospitals, pharmacists and pharmacy technicians check prescriptions, explain dosages, and ensure that each patient receives the right medication safely. It's the silent department that keeps every other one working properly. Physiotherapy unit, or physical therapy. After illness or surgery, recovery begins in the physiotherapy unit. In the US, this is called physical therapy. Physiotherapists, or physical therapists, help patients regain movement, strength, and independence. It's a place full of hope and progress, where every step counts. Recap. Let's review what we've learned. We explored 11 departments: emergency room, or A&E, intensive care unit, operating theater, or operating room, radiology, or imaging, maternity ward, or labor and delivery unit, pediatrics, Paediatrics, oncology, cardiology, pharmacy, chemist or drugstore, physiotherapy, physical therapy, reception, information desk. Each department has a special purpose and its own vocabulary. And though the British and American words may differ, the goal of healthcare remains the same: to heal, to help, and to give hope. So next time you visit a hospital or study medical English, you'll know exactly where you are and what each place is called. If you enjoyed this hospital tour, give the video a like, subscribe to the channel, and share it with someone learning medical English. Thank you for watching, and see you next time for another journey into the language of medicine.